Good afternoon, everybody. I'm Todd Sorensen, Senior Executive Associate Dean for Strategic Initiatives and Faculty Affairs and Professor of the College of Pharmacy, and I'm honored to join you today and as we're here to celebrate with all of you and find that it's fitting that we're having this opportunity to celebrate during Graduate and Professional Student Appreciation Week. I don't think we specifically planned it. There was a lot of other reasons why this was the date that was picked, but it's a nice coincidence that this is Graduate and Professional Student Appreciation Week. I can imagine you might tell us that sometimes you don't always feel appreciated, but you are appreciated by the College of Pharmacy, and it's fitting that we're able to have this celebration this week. I do bring to you greetings from Dean Wellage, who very much wishes that she was able to be here for this milestone. She sends her best and looks forward to a time very soon when she can join us in person for these moments of connection and joy, and she takes a sense of connection and joy herself from these, so I know that she is disappointed that she's unable to be here. Today marks your important transition from the classroom, full of assignments, tests, and grades, into the clinical setting where you'll have direct interaction and impact on patients. You excited? About a month or so away from that first APPE. Maybe a little anxious. As I was driving up, I was trying to remember what my summer of 1993 was like. That's when I started my fourth year. I can't remember what my first rotation was. It was either emergency medicine at Hennepin County, or maybe it was chronic kidney disease at Hennepin County. Must have been one of those two, because some of the other ones I can remember later, but I'm sure I felt the same way you're feeling now. Excited, wondering whether or not I'm prepared, and then quickly finding out that I was more prepared than maybe I thought I was at the time. So as you make this shift, you may be surprised by the rate of growth that you will experience in your fourth year. In years 1 through 3, you developed a solid foundation. Now you're about to use that foundation to step into actual care settings and put into practice all that you've learned about caring for patients. It's very likely you'll see and feel as much or more growth in your readiness to be a pharmacist in this next year as you have in the first 3. You are a class of resilient, hardworking, and eager to learn students. All of these attributes will carry with you through the next year and well into your career. As a fourth-year PharmD students, which soon we will be calling you P4s, in our shorthand, you'll get to explore different practice settings and future career paths. The stressful situations and challenging times you encounter along the way will feed your development as pharmacists. At the College of Pharmacy, we aim to prepare the best pharmacists in the country. This is not an easy program. You know that. You've experienced it for 3 years. Your success in the classroom is a tribute to your commitment to your excellence, your willingness to persevere, and your adaptability in rapidly changing environment. Your time and skills used to support the patients, communities, and fellow classmates are a clear demonstration of your commitment to help others. Your accomplishments are impressive, and they are shaping you to be the best pharmacist in the nation. Today's event is an opportunity to celebrate these achievements and look ahead. It's also a reaffirmation of your commitment to professionalism and to your future patients. The pins you are receiving today are intended to signify just that. They are a symbol of your pledge to professionalism and a celebration of the learning and development that has brought you to this point today. They are also a reminder of the professional community you'll be joining in your final year of study and your connection to the College of Pharmacy. I hope you will wear them with pride. You are at the start of an exciting adventure, and it begins with this celebration today. I can think of few better ways to get you started by hearing from someone who has been on the receiving end of the type of care that you will receive, or that you will provide. We're joined today by Dr. Kjell Knudsen, the former dean of the Leibovitz School of Business and Economics and a long-standing contributor to the Duluth community. However, we've asked him here to join us here today, not in that capacity, but as a person who has important health and healthcare experiences, particularly and negative experiences working with the healthcare system to manage his health. Importantly, he is a former patient of Dr. Hager's, and as a result, he has a unique perspective of the role that pharmacists can play and should play in patient care. He's here to share some of his experiences and help ground us all in the pharmacy-related needs of patients. This is a particular poignant message for P3 students transitioning from the classroom to the next year of learning and serving the healthcare needs of patients like Shell. Please join me in welcoming Dr. Shell Knudsen.
Thank you, Dr. Sorensen. Boy, you all look so young. And you're good looking too, that's for sure. It is true that in many of my friends around town here that I have been known to brag about Dr. Hager, that she at one point saved my life. So now I'm going to tell you the story. And I'll do it this way. In the early morning of, yeah, I want to do that.
Now up here is not quite.
Now I can see.
There we go, that's much better.
So in the early morning of July 5th, 2011, it's a few years back, I was rolled into the operating room at St. Mary's Hospital in Duluth for a non-invasive coronary bypass operation. The surgeon was a Dr. Konda, who was also known as a magician in our community. He operated on my heart while it was still beating. And the night before the surgery, he had one of his PAs send my wife out to get some barbecued ribs, because it was the 4th of July. So he sent her out to get some ribs that we could share with the family in our hospital room. And I, of course, being a Norwegian and pessimistic as they come, I thought he did that because he knew that this would be my last meal. But as you can see, I came through it okay. The story is that I had been a patient of Dr. Hager at the UMN MTM clinic for some time, because during my deanship, I was struggling with some obesity. I was smoking at the time, though I had quit or tried really hard to quit. And I was also struggling a little bit with drinking too much, which I have since quit. I probably not had a drink in what is now probably about 15 years, and it wasn't hard to quit, I just quit. And so I happened to come down to the MTM clinic one day, and we went through the process with Dr. Carey. I think I'm going to call you Dr. Carey from now on. And she looked fairly concerned. And she told me to get my wife and go to the emergency. And at the same time, apparently, she called my doctor and let him know that she was concerned. So now you know the rest of the story. I was immediately put in the hospital. And the first thing that happened to me was that someone tried to put a stent in my artery. But that didn't last very long. The equipment came back out, and the surgeon said, no, we're not going to be able to do this. We got to schedule you for surgery. So that's what happened. And I am so grateful for the MTM clinic and what happened there, because it seems to me that during the existence of the MTM clinic at UMD, we had some place we could go and we could be trusting that we were under care without having to wait to have a heart attack. I never had a heart attack in my whole life. Never, because this was caught before I had to go through that mess. And so this was really something that I appreciated. Now, in the aftermath of all of that, I have made a number of visits to hospitals and clinics. And one of the things that I really miss, at this point, I think because of some health problems, I take a lot of medications. But I have not had the advantage of something like the MTM clinic. I cannot recall in the time after my surgery for the heart that I have been able to sit down with a pharmacist and go through the medications that I take. So I have really not much knowledge of the impact of all of these medications and how they interact. I know that my GP isn't fooling me. I mean, I know that I'm not being fed medications that are going to harm me. That I trust. But I simply do not know how these medications, what their impact is, and what I can expect in terms of how they interact. Since I'm pretty much up and walking around, I know they're not harming me too much. But I miss the interaction with someone who I can ask questions of and all that sort of stuff. And if you know, and I'm sure you do, the time you spend with your GP today, you know, in some ways they don't have much time is what the reality is. You don't have time to go through that. And when the nurses go through the medication is to make sure that the list is correct. That's it. Are you taking this? Are you taking that? Yeah, I am. But that's about where it stops. So I am concerned as a patient that maybe there is a team behind the curtain, but I don't see it. I wish there was a team behind the curtain where a pharmacist was part of that team. And I don't know if all hospitals or clinics or whatever, I don't know if they all have teams of MDs and other specialties, you know, or whether it is like we used to say in academe, that when somebody wanted to write an interdisciplinary book, 5 people wrote a chapter each and put it together and said they had written an interdisciplinary book, but they never talked to each other. And so I just, though, in a positive sense, had a very positive experience yesterday with my GP, who was prescribing some new medications for me, and he sent me home and said he wasn't going to finally prescribe anything until he had had a chance to think about what he was doing last night, because he wanted to check the medications and see what the interactions and everything was. But I wondered, well, where is your pharmacist? Why don't you talk to your pharmacist who's on your team? My guess is he did it. And I don't know whether that's the correct approach or not as a patient. Anyway, I wish he had had a pharmacist on the phone that he could have just checked it out with. So, for what it's worth, I hope you all are going to be on a team. And don't go looking for someone who has a problem with his or her heart. Thank you very much, and good luck to every one of you. I hope you have a great career.
Thank you, Shell. Would you like Dr. Carey to call your GP right now? She's probably already dialing it right now. Thank you. What a great message. And students, I hope you hear the call to action in his words today. It's not just for those who are already licensed, but for all of us that are out taking care of patients. And I do have to say, your comment about wondering what's behind the curtain. I know what's behind the curtain, but yet it is a call to be seen. From my own experience, my father-in-law had triple bypass surgery about 1.5 years ago. In and out of the 4 different hospitals, 22 or 3 days of inpatient acute care. Never saw a pharmacist once. I know they're there. I know what they're doing. But if the patients don't know that they're there, I think we have challenges, as you have outlined for us and have called us to action. So thank you for your words today. At this time, I'd like to invite Dr. Heather Blue, Associate Professor, to come up and welcome the class to the experiential education portion of your education.
Well, class of 2025, congratulations to getting to this point. I know that in just a few short weeks and a couple acute care exams, later you'll be heading off on your final year, finally getting to do your APPE experiences. And I want to welcome you as both a preceptor as well as part of our experiential education team, welcome you to this new practice. Now, I'm really excited that finally you'll be able to really apply the education and the learnings that you've so diligently spent hours studying for, as well as being able to learn from all of our preceptors. We honestly have some of the best pharmacists in the country, and you get to learn from them side by side. But most of all, I'm excited that you will be able to care for real patients. Enough of those fake patients that we make up and give you just a little bit of information. You'll have real patients. And you will be able to care for them, which hopefully will reinvigorate some of your passion for pharmacy practice, while also providing you a real understanding of the responsibility that our profession has for both the care of our patients as well as all the safety aspects. And so thinking about, it's not just picking the drug for the patient, it's about thinking of their whole regimen, the efficacy and safety part. So go out, enjoy your APPE rotations, ask lots of questions. As Dr. Sorensen said, it's okay, step out from behind the curtain, ask questions, meet your patients, just soak up everything you can from that year of experiences. Sometimes you'll open doors to new thoughts, new areas of practice you never thought you'd like. And sometimes it's about closing those doors and saying, you know what, pharmacy's huge, and that's part that maybe I don't fit. So go out, enjoy that year, and then we'll see you back at graduation. So good luck, congratulations, and enjoy rotations after the acute care exams.
Thank you, Dr. Blue. Now it's my pleasure to introduce our keynote speaker. Dr. Ann Byrie is the Vice President of Pharmacy Services at Allina Health. Dr. Byrie is a 2001 graduate of South Dakota State University College of Pharmacy, and she began her pharmacy practice at Target Pharmacy in various pharmacist and leader roles before joining Allina in 2009. With Allina Health, she has a unique opportunity to work with and help advance many different aspects of pharmacy practice, including outpatient, specialty, hospital, ambulatory care, home infusion, and system pharmacy support services. In addition, she also supports outpatient medical imaging across Allina Health. Dr. Byrie is also a past president of the Minnesota Pharmacists Association. As you can tell, she's got a wealth of experience and knowledge to share with you as you embark on the next journey. And so welcome, Dr. Byrie.
Well, thank you, Dr. Sorensen. And again, I'm Ann Byrie, and I'm honored to be here today with you in this momentous milestone in your pharmacy journey for your pinning ceremony. And as he mentioned, I lead pharmacy services at Allina Health in Minneapolis, and really have the unique opportunity to work with every area of pharmacy practice. And it's a pleasure to be here today. So you may have heard that I received my PharmD from South Dakota State University, so I'm not a gopher, but I have had the pleasure and honor to work closely with the Leadership Emphasis program here at the college for many, many years, and have hosted countless APPE students over the years as well. So I can remember back to 2003, my very first student that I precepted, his name was Mike. And just most recently, last block, I hosted Nirmana, who many of you maybe know. I wish I knew the exact number of students that I've had the pleasure of learning from and precepting over the last 23 years, but just grateful to be here today. So I hope to share just a few remarks and a couple insights that may come in handy as you embark on your rotations and early careers. So students, I invite you to close your eyes, take a deep breath. You are here in this moment. Picture, if you will, your dream pharmacy job. What is that dream pharmacy role for you? How did you get there? Who helped you along the way? What are you proud of in that role? Now you can open your eyes. Show of hands. How many of you pictured a straight arrow trajectory towards that dream job? Anyone? Pharmacists were kind of wired that way sometimes to what's the quickest path from point A to point B. Show of hands, how many of you pictured a path to your dream pharmacy job that was a little bit more uncertain or unknown or tangled? That's okay too. It's okay, absolutely, at this point to not know what that dream pharmacy job is. And then lastly, how many of you envisioned more of a winding path or a circuitous route filled with continuous learning, mentorship, and growth as a pharmacist? Anyone? Of course, there's not a right or wrong answer to this hypothetical test, but I'm here to assure you that based on my own experiences and those of many of my colleagues, with a wide variety of years of service and a wide variety of different practice settings, that I predict that the path for most of you will be more of that winding, continuous learning journey with hopefully some enjoyment along the way. So I have 4 quick tips for you to consider as you embark on your APPE rotations and ultimately your pharmacy journey. So number 1, be curious. Famous people smarter than I, like Walt Whitman or Ted Lasso, if there's any fans in the audience, encourage us to be curious, not judgmental. So take their advice, even if you find yourself in a practice setting that you think is not for you. Ask thoughtful questions. There is something to learn from every single practice setting that will ultimately make you a better pharmacist and patient caregiver at the end of the day. You might also just be surprised at where your passions end up and evolve to over time on your pharmacy journey. So be curious. Number 2, be humble. Starting off your APP rotations or your residency or your first job, you might feel like the pressure, like I did, to have every answer on the tip of your tongue. It can definitely be very intimidating when you're in rounds with providers and they are asking you a medication question and you want to have it on the tip of your tongue. But I have been there too, and it is intimidating. But I would say for us as pharmacists, being humble with high integrity is synonymous with patient safety. because pretending to know the answer to a medication question that you don't know just to save face in that interaction could have severe consequences for your patient and for yourself. So I encourage you to be humble enough to say, I don't know the answer to that question, but I will find it in short order and get back to you. When you take the oath of a pharmacist in just a few minutes, I know you will all take it seriously to guide your pharmacy journey. So be humble. Third, give it your all. You've likely heard many times by now that pharmacy is a small world. Truly, truly it is. Pharmacy professionals are interwoven across practice settings through local and national professional organizations, colleges of pharmacy, mentorships, advocacy, leadership, continuous learning, publications, friendships, and so much more. That's why I tell students I work with that no matter where you find yourself on APPE rotation, at a paid internship, at your residency, or in your first jobs, give it your all, because you just never know about the work that you're doing now or the relationships that you form might end up opening doors or closing doors for you in your pharmacy journey. So give it your all. And lastly, enjoy the journey. The truth is that you will likely spend a plethora of time at work in your pharmacist career. Some days will feel golden and purposeful, and some days will be really, really hard, no matter what area of pharmacy practice you end up working in. Maybe what you're picturing today as your dream job might not be your dream job after all, and that's quite okay too. At the end of the day, we are called as pharmacists to use our knowledge, skills, and experience to positively impact patients. And within that calling, alongside your healthcare peers, that you will undoubtedly end up calling lifelong friends, I assure you that there is also an overabundance of joy. So enjoy the journey. I wish you all the best in your pharmacy journey ahead, and thank you very much, and let's connect.
Thank you, Dr. Byrie. I have the opportunity to get to read reflections from the students who've done rotations with Dr. Byrie in the LEA. And one of the most common terms that comes up in those reflections is inspiring. And so you've inspired many students before. Thank you for inspiring the group today as we get ready to move into the pinning component of our session today. So at this time, I'd like to invite Assistant Professor Dr. Jacob Brown to the other microphone. And I invite the faculty members who will do the pinning to their station. Our faculty pinners today include Associate Professor Dr. Heather Blue, Associate Dean for Clinical Affairs and Professor Dr. Harry Hager, Associate Professor Dr. Lee Okoro, and Associate Professor Dr. David Stanyam. Students, here's your instructions. Before you leave your seat, please make sure that you are wearing your white coat. As you put your white coat on, make sure you also have your name card in your hand so that you can give it to Dr. Brown. Once your name is read, you'll step up to Dr. Byrie to receive your pin and a handshake. You'll then move over to the pinning station where one of our faculty pinners will eagerly be waiting for you. And here's the important part. Hold out your pin card out for the pinner. Let them remove the pin from the card, and then they will put it on your white coat. Once your pin is secured, you can then return to your seat. We are going to release by tables, one at a time, and you can line up near Dr. Brown. So we will start in that far back corner right there.
Lauren Gansky. Emily Streit. Anna Skubel. Sophia Serafimov. Kelly Chise. Dina Zheng. Joseph Carls. Aaron Hess. Hunter Eldine. Marshall Peters. Jinu Vang. Rocky Shu. Matthew Knoll. Sylvian Fonka. Allison Enger. Carly Hallen. Emma Carlberg. Margaret Matson. Lauren Towley. Kara Johnson. Alyssa Ruberg. Katarina Hansen. Alessandro Miguel Amores. Vanessa Nacy. Lindsay Nelson. Saloni Desai. Taja Nihat. Trevor Sheldon. Brandon Gillick. Annie Lindgren. Angelo Azuzu. Mai Dang. Duck Pham. Tu Tao. King Yang. Chimua Kang. Jimmy Morales. Kate France. Julia Beerance. Brooklyn Mason. Michaela Narvison. Cody Coleman. Maddie Peterson. Kendra Young. Jessica Vu. Samantha St. Jock. Gauchua Vang. Emily Yang. Gao Yang. Sheng Li. Lelia Yang. Jacob Vang. Rachel Cohen. Valerie Wynn. Tui Ho. Emily Letcher. Catherine Lim. Aubrey Bacorny. Alex Larson. Mead Avery. Elise Moore. Damon Prow. Beth Vlieger. David Dahl. David Kabuye. Madeline Reichman. Anthony Tadman. Trevor Lindsay.
All right, good afternoon and congratulations, students. As you all know, but for our guests in the room, I am Dr. Olihe Okoro, and I have the privilege of being one of the faculty advisors for the PharmD class of 2025.
And I'm Dr. Kylie Funk, and I have the honor of serving alongside Dr. Okoro as the other co-advisor for this class. At this time, we'd like to ask students to please rise and join us in reciting out loud the oath of the pharmacist as a recommitment to the values we uphold in our profession. You'll find the oath printed inside your program.
I promise to devote myself to a lifetime of service to others through the profession of pharmacy. In fulfilling this vow, I will consider the welfare of humanity and relief of suffering my primary concerns.
I will promote inclusion, embrace diversity, and advocate for justice to advance health equity.
I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients.
I will respect and protect all personal and health information entrusted to me.
I will accept the responsibility to improve my professional knowledge, expertise, and self-awareness.
I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct.
I will embrace and advocate changes that improve patient care.
I will utilize my knowledge, skills, experiences, and values to prepare the next generation of pharmacists.
I take these vows voluntarily with the full realization of the responsibility with which I am entrusted by the public. Thank you, students. You may be seated.
Thank you, students, for reaffirming this important commitment to our profession. Doesn't it feel like there should be a little round of applause, a little bit of a yahoo? You've recited it before. I hope that today's recitation means a little something different, a little bit more as you know what's ahead of you coming over the next year. So every year we look forward to the opportunity to acknowledge this transition of third-year students into the final year of the School of Pharmacy. As you set out on the fourth-year experiential journey, we hope you'll stay connected. Know that the whole college community is here cheering for your every success. You are the key to advancing and growing pharmacy as a profession. We can't wait to see what you do next. So before we conclude, there's a few housekeeping notes. First, thank you to Drs. Knudsen and Byrie, and for their inspiration today, I have gifts. It's really added a lot today to have both of you here and to contribute to this event in honor of the students, so thank you both. My thanks also to the event team. They're over there. I think there's some over here. We're in a new space. We have a little bit of changes to the programs. Everything was great. Thank you all for everything that you did to help make this day special. The Ent team, and I didn't say, I include student services in that too, if you didn't know. So everybody was responsible for bringing this day together. And then lastly, for students, we are going to work with the photographer to capture a group photo right after this. So stay close and wait for further instructions.
Go out that door and down the walk that way. Don't go in the lake.
And that's going to be right now? All right, so congratulations. Look forward to your fourth year. Let's go take a photo.